The muscular system. The muscular system is an organ system consisting of skeletal, smooth or visceral, and cardiac muscle that will be discussed later on. Muscles provide strength, balance, posture, movement, and heat for the body to keep warm. It also provides mobility and movement. Found in everywhere throughout the body, muscles are tough elastic tissues that contracts to make our body parts move. We use muscle to walk, jump, throw a ball, or even blinking eye. Muscles in our chest make breathing possible. Muscles in our heart pump our blood throughout our circulatory system. And muscles in our stomach and intestines move food to our digestive tract. Muscles are responsible for maintaining our posture and your physical activities to produce heat. About 40 to 50% of our body weight is made up of muscle tissue. A little more in men and a little less in women. These structures are responsible for every movement we made. Muscular contraction. Many skeletal muscle like the biceps muscle are spindle-shaped, which means they are fatter in the middle or toward the tendon at the end where they are attached to the bone. The fatter part of the muscle is called the belly and it is made up of bundle called fascicles. Each fascicles is a bundle of muscle fiber. Each fiber is a single cell running a length of a muscle and can be up to 30 centimeters long. A single skeletal muscle fiber is an unusual cell. Unlike most of our body cells, which is possess a single nuclei, it possesses multiple nuclei on its outer surface, and it is made up of bundle of myofibrils. Myofibers in the cells are made up of actin or myosin filaments, which are arranged in an end-to-end separate units called the sarcomeres. This gives muscle fibers its distinctively straightened or banded appearance. The entire skeletal muscle structure is rather like a car antenna or a telescope. Multiple bundles tightly packed inside one another. Tissue surrounding the bundle contains blood vessels, which provide oxygen and fuel to the muscle, and nerve cells, which transmit signal to the muscle, causing it to contract. When the nerve cell is received, calcium is released inside the muscle fibers, which causes them to contract. Actual contraction appears when thin actin filaments are pulled toward the thicker myosin filament that shortens the sarcomere. When this reaction takes place along each muscle fibers, the whole muscle contracts up to as much as one-third of its normal length. Subsequently, as the muscle relaxes, the actin filament slides back to its original position and the whole muscle expands back to its original length.
There are three different types of muscles. The first type is called the skeletal muscle, in which there are over 400 in the human body, and they are attached to bone smooth parts of the skeleton in their relation to each other. These muscles are under conscious or voluntary control. Skeletal muscles are used in different activities such as running, jumping, lifting, or other movements at the body. The second type of the muscle is called the smooth muscles. This is not voluntarily controlled. Smooth muscles lie in many hollow internal structures, such as blood vessels and intestines, and it changes the shape of this structure when it contracts. The third type of muscle is the cardiac muscle, which is found exclusively in the heart. Unlike skeletal and smooth muscles, cardiac muscles contract continuously without needing any trigger from the outside.
So let's talk about the first type of muscle, the skeletal muscle. It is composed of a long fiber surrounded by a membranous sheath, the sarcolemma. The fibers are elongated, sausage-shaped cells containing many nuclei and clearly display longitudinal and cross striations. Skeletal muscle is supplied with nerves from the central nervous system and because it is partly under conscious control, it is also called the voluntary muscle. Most skeletal muscles are attached to portions of the skeleton by the connective tissue called tendons. Constructions of skeletal muscles serve to move the various bones and cartilages of the skeleton. Skeletal muscle form most of underlying flesh of vertebrates. Skeletal muscles are usually found in bundles composing muscular structure resembling organs and function. These often rifle the skin during muscular action. The shape of the muscular organ is dependent on its location and function. Such a muscle structure is scientifically according to its shape, function, or attachment. The second type of muscle, or smooth muscle, is also called the visceral muscle. It is an involuntary type of muscle and is composed of spindle-shaped cells, each having a central nucleus. The cells have no cross striations, although they do not exhibit faint longitudinal striations. Stimuli for the construction of smooth muscle are mediated by the autonomic nervous system. Smooth muscles are found in the skin, internal organs, reproductive system, major blood vessels, and excretory system. Smooth muscles are also found in organs made up also of other tissues such as the heart and the intestines, which contains layers and connective tissue. The third type of muscle is called the cardiac muscle, and it composes most of the vertebrate muscle. The cells which shows both longitudinal and imperfect cross striations differ from skeletal muscles, primarily in having a centrally placed nuclei and interbranching and interconnecting of fibers. Cardiac muscles are not under voluntary control. It is applied of nerves from the autonomic nervous system, but autonomic impulses merely speed or fluids actions and are not responsible for the continuous rhythmic contractions characteristic of living cardiac muscle.
So the muscles responsible for facial expression. So these muscles are innervated by the seventh cranial nerve, the facial nerve. So when you're testing a patient's cranial nerves and you get to cranial nerve number 7, you ask them to wrinkle their forehead, to close their eyes as tightly as they can, to show you their teeth by making a smile, and asking them to puff their cheeks out. So this is a crude test of the muscles of facial expression. So the way I'm going to do this tutorial is that I'm going to start superiorly and work through the various muscle groups in the face. So the orbital muscle group, the nasal muscle group, and then the muscles in the oral region. So to begin with, looking at the most superior muscle on the face, you can see this muscle here, which is the frontal belly of the occipitofrontalis muscle. And it's called the occipitofrontalis muscle because it consists of two muscle bellies. So you've got the occipital muscle belly, so called because it's on the occipital region of the skull, and you've got the frontal belly of the occipitofrontalis. And connecting these two muscle bellies, you've got this flat tendon sheath, this aponeurosis. And if you have covered the layers of the scalp, you'll have been told that the aponeurosis of the occipitofrontalis makes up the third layer of the scalp. So you've got skin, connective tissue, aponeurosis, loose connective tissue, and then the periosteum. So the aponeurosis of the occipitofrontalis is the third layer of the scalp. So if we just look at the orbital region, we can see these muscles which surround the eye, and this muscle is called the orbicularis oculi, and it acts sort of as a sphincter of the eye, and you've got an outer part and an inner part to this muscle. So this outer part here is called the orbital part, and it's responsible for closing the eyelids forcefully. If I just zoom in a little bit more, you can see the inner part of the orbicularis oculi, and this is called the palpable part, and it resides inside the eyelid, and it's responsible for closing the eyelid gently. So that's the orbicularis oculi, this circular muscle responsible for closing the eyelids. So the next muscle is this muscle here, the corrugator supercilii, and it lies just deep to the orbicularis oculi, and it draws the eyebrows medially and downward. There are three muscles associated with the nasal muscles of the face in the nasal group. So you've got the procerus, you've got the nasalis, which consists of a transverse part and an alar part, and you've got this muscle in the midline, which is called the depressor septi nasi. So the procerus muscle here on either side originates on the nasal bone and inserts onto the skin of the forehead, and this muscle is active when an individual frowns. And these muscles here, the nasalis, which consists of the transverse part and the alar part, is responsible for compressing and flaring the nostrils, the nares. So the transverse part compresses the nostrils, and the alar part of the nasalis helps to flare the nostrils. It opens them out. And this muscle here, the depressor septi nasi, so the name kind of gives away what it does. It depresses the nasal septum, so it draws the nose down inferiorly. So it actually inserts onto the nasal septum, and it assists the alar part of the nasalis in widening the nostrils. So those are the three muscles of the nasal group of the facial muscles: the procerus, the nasalis, and the depressor nasi septi. So the next group of muscles is the oral group of muscles, and as you can see, there's quite a lot of muscles which make up this group. So if you're not interested in learning about all those in detail, then I'll just cover the two muscles that you need to know, and you can switch off after that, and then if you're interested you can carry on listening to find out about the other muscles. So what you need to know in the oral group, if you're only going to learn two muscles, is that there's this big muscle here which forms a circle around the mouth, and this is known as the orbicularis oris. So just like you've got the circular muscles around the eyes which constrict around the eyes, the orbicularis oculi, you've got the orbicularis oris. So in Latin, oculus is an eye, and oris is a mouth, so orifice, oris, help you to remember that. So orbicularis oris, this circular muscle which circles the mouth, and you can kind of guess what the function is. When it contracts, it narrows the mouth and closes the lips, so you get this pursing action which you get when you're whistling, and that's brought about by this muscle, the orbicularis oris. this muscle here is the trapezius. You probably all know this one. And this muscle elevates and depresses the scapula, and it can also retract the scapula. So that's trapezius. You've got the latissimus dorsi here, which is Latin for the broadest muscle of the back, and this is the biggest back muscle, obviously. And this muscle inserts onto the humerus, so it adducts, extends, and internally rotates the humerus. So just working our way deeper, just underneath the trapezius you've got the rhomboids, the rhomboid major and the rhomboid minor. And these muscles attach to the scapula, and they function to keep the scapula pressed against the thoracic wall. And when the trapezius is contracted, they can retract the scapula. So here you've got the levator scapularis, and this muscle, as you can see, it attaches to the top of the scapula, and it elevates the scapula when it's contracted. So that's the levator scapulae, these two muscles here. So those muscles which I've just covered are the extrinsic muscles of the back. Now we're going to be working our way deeper to the intermediate muscle there. And here you've got the serratus posterior superior and the serratus posterior inferior. So you can see these muscles, they attach to the ribs, and the superior one elevates the ribs and the inferior one depresses the ribs. So that these are the intermediate muscles involved in respiratory function. So now we've got the deep muscles of the back, the intrinsic muscles, which are responsible for the movement of the spine and the head. So you've got these spinotransversalis muscles, which move the head and neck. You've got the splenius capitis and the splenius cervicus, two spinotransversalis muscles. This muscle here is the splenius capitis, and as you can see, it inserts onto the skull. So what this muscle does, if both muscles are contracted, it draws the head backwards and extends the neck. If just one of the muscles is contracted, then it will rotate the head round to that side. So that's the splenius capitis. For some reason on this model, the splenius cervicus isn't shown, but this originates a little bit lower down and inserts onto the transverse process of the first vertebra. Sorry, get rid of those. So next we've got those muscles which move the vertebral column. You've got the erector spinae muscles and the transversospinalis muscles. The erector spinae muscles are more superficial, so I'll begin with those. You've got three groups. So laterally you've got the iliocostalis, this one here. In the middle you've got the longissimus, and most medially you've got the spinalis. So an acronym, not an acronym, a mnemonic for remembering this is I long for spinach, I iliocostalis, long longissimus, spinach, spinalis. So laterally to medial. Those are the erector spinae muscles, and these are the primary extensors of the vertebral column and head, and they're the largest group of intrinsic back muscles. So deep to the erector spinae muscles, you've got the transversospinalis muscles. So you've got three transversospinalis muscles, the semispinalis, which is the most superficial. You've got the multifidus here, and then most deep you've got the rotares muscles. So
Muscles on the arm. Different parts of the muscles on the arm. Muscles that act on anterior arm. The deltoid muscle is located on the outside of the shoulder and is recognized by its triangular shape. The most function of the deltoids is to prevent the dislocation of the humeral head when a person carries heavy loads. The pectoralis major is a thick fan-shaped muscle situated at the chest of the human body. It makes up the bulk of the chest in the male and lies under the breast in the female. Underneath the pectoralis major is the pectoralis minor, a thin triangular muscle. The bicep brachii muscle or simply biceps is a large muscle located at the front of the upper arm. This muscle helps flex the forearm which allows the elbows to bend. Additionally, the bicep brachii muscle contracts to raise the forearm. The coracobrachialis is the smallest of the three muscles that attach to the coracoid process of the scapula. It is situated at the upper and medial part of the arm. The action of the coracobrachialis is to flex and medially rotate the arm. The subscapularis is a large triangular muscle which fills the subscapular fossa and inserts to the lesser tubercle of the humerus and at the front of the capsule of the shoulder joint. Muscles that act on the shoulder. The serratus anterior is a muscle that originates on the surface of the first to eighth ribs of the side of the chest and inserts along the entire anterior length of the medial border of the scapula. It pulls the scapula forward around the thorax, which is essential to the anteversion of the arm. The pectoralis minor muscle is a thin triangular muscle situated at the upper part of the chest beneath the pectoralis major in the human body. The pectoralis minor depresses at the point of the shoulder, drawing the scapula inferior and medial towards the thorax and throwing in the inferior angles posteriorly. Muscles that act on the posterior shoulder. The levator scapulae is a skeletal muscle situated at the back and the side of the neck. As the name suggests, its main function is to lift the scapula. The trapezius muscle is a large superficial muscle that extends longitudinally from the occipital bone of the lower thoracic vertebrae and lateral to the spine of the scapula. Its functions are to move the scapulae and support the arm. The rhomboid major muscle is a skeletal muscle on the back that connects the scapula with the vertebrae of the spinal column. In human anatomy, it acts together with the rhomboid minor to keep the scapula pressed against the thorax wall and to retract the scapula toward the vertebral column. Muscles that act on the forearm. Muscles that act on anterior forearm. The bicep brachii muscle or simply biceps, as said a while ago, is a large muscle located at the front of the upper arm. This muscle helps flex the forearm which allows the elbows to bend. Additionally, the bicep brachii muscle contracts to raise the forearm. The brachialis muscle is a muscle in the upper arm that flexes to the elbow joint. It lies deeper than the biceps brachii and is a synergist to the assist the bicep brachii in flexing at the elbow. It makes up the part of the vertebral region known as the cubital fossa. Muscle that act on the posterior forearm. As you can see in the diagram, there are three colors which are mainly red, yellow, and green. The red stands for long head, yellow stands for lateral head, and green stands for medial head. They are parts of the triceps brachii muscle. Tricep brachii muscle is the large muscle at the back of the upper limb of many vertebrae. It is a muscle principally responsible for the extension of the elbow joint.
Few structures of the human anatomy are as unique as the hand. The hand needs to be mobile in order to position the fingers and thumb. The hand must have adequate strength to grip objects firmly, but must also be coordinated to perform fine motor tasks with precision. The important structures of the hand can be divided into several categories. These include bones, joints, ligaments, tendons, muscles, nerves, and blood vessels. Let's define some common anatomic terms as they relate to the hand. This will make it clearer as we talk about the structures of the hand later. The front or palm side of the hand is referred to as the palmar side. The back of the hand is called the dorsal side. The half of the hand from the middle finger to the thumb is called the radial side. The other half is called the ulnar side. Many of the muscles that control the hand start at the elbow or forearm. They run down the forearm and cross the wrist and hand. Some control only the bending or straightening of the wrist. Others influence motion of the fingers or thumb. Many of these muscles help position and hold the wrist and hand while the thumb and fingers grip or perform fine motor actions. Most of the small muscles that work the thumb and little finger start on the carpal bones. The bulge of muscle at the base of the thumb in the palm is called the thenar eminence. The bulge of muscle at the base of the little finger is called the hypothenar eminence. Four muscles make up the thenar eminence: the abductor pollicis brevis, flexor pollicis brevis, adductor pollicis, and opponens pollicis. Pollicis is the Latin term for thumb. Each of these muscles begins at the wrist, and each has a tendon that attaches to a different location on the base of the proximal phalanx of the thumb. Their names give a suggestion of what they do when they contract. The abductor pollicis brevis abducts or moves the thumb away from the midline of the hand. The flexor pollicis brevis flexes or bends the thumb. The adductor pollicis adducts or moves the thumb towards the midline of the hand. The opponens pollicis moves the thumb into opposition. It pulls the thumb out from the palm and turns the pulp of the thumb to face the palm. This is the motion that allows you to place the tip of your thumb against the tip of your little finger. The muscles of the hypothenar eminence are arranged and function roughly the same in the little finger. The smallest muscles that originate in the wrist and hand are called the intrinsic muscles. The intrinsic muscles guide the fine motions of the fingers by getting the fingers positioned and holding them steady during hand activities. The tendons that allow each finger joint to straighten are called the extensor tendons. The extensor tendons of the fingers begin as muscles that arise from the backside of the forearm bones. These muscles travel towards the hand, where they eventually connect to the extensor tendons before crossing over the back of the wrist joint. As they travel into the fingers, the extensor tendons become the extensor hood. The extensor hood flattens out to cover the top of the finger and sends out branches on each side that connect to the bones in the middle and end of the finger. The place where the extensor tendon attaches to the middle phalanx is called the central slip. When the extensor muscles contract, they tug on the extensor tendon and straighten the finger. Problems occur when the central slip is damaged, as can happen with a tear. The flexor tendons allow the fingers and thumb to flex or bend to grip objects in the palm of the hand. The strong flexor muscles begin in the forearm, and just before they enter the wrist, the flexor muscles form the flexor tendons. It only has two phalanges. The flexor pollicis longus begins in the forearm, and its tendon connects to the base of the distal phalanx of the thumb. The flexor pollicis brevis muscle begins in the wrist, and its tendon connects to the base of the proximal phalanx of the thumb. All of the nerves that travel
All right, let's get started. Next, we're going to talk about the muscles of the hip. First is gluteus maximus. It originates on the posterior superior iliac spine of the ilium, abbreviated as PSIS, and inserts into the gluteal tuberosity of the femur. The action it performs is extension of the thigh, and it also laterally rotates the thigh. Next is tensor fascia latae. The origination is the iliac crest, and insertion all the way down at the tibia by way of the iliotibial tract, or the IT tract. The actions it performs is abduction of the femur and also flexion of the femur, and it rotates the thigh medially as well. Here we're looking at the iliacus muscle of the hip. The origin is the iliac fossa, the insertion is the lesser trochanter of the femur, and this muscle works hand in hand with another muscle of the hip called the psoas major. Psoas major originates on the bodies and transverse processes of lumbar vertebra 1 through 5, also inserts on the lesser trochanter of the femur. Now together these muscles are called the iliopsoas. They both perform the actions of flexion of the thigh and flexion of the vertebral column and pelvis. Here we're looking at adductor magnus. It originates on the ramus of the ischium, right here, and then inserts into linea aspera. Its primary action is adduction of the thigh at the hip. Here we have the gracilis muscle. It originates on the inferior ramus of the pubis, here, and inserts on the proximal medial surface of the tibia. Its primary action is adduction of the thigh, just like that. Here we have the sartorius muscle. It originates on the anterior superior iliac spine of the ilium and inserts on the proximal medial surface of the tibia. Its primary action is flexion of the thigh, laterally rotates the thigh, and abduction of the thigh at the hip. Next, we're going to look at the quadricep group of muscles in the thigh. First is the rectus femoris. It originates on the anterior inferior iliac spine of the ilium, just above the acetabulum, and inserts on the tibial tuberosity of the tibia. Its primary action is flexion of the thigh. It also extends the leg at the knee. Next in the quadricep group is the vastus medialis. It originates on the linear aspera of the femur and also on the intertrochanteric line of the femur and inserts on the tibial tuberosity of the tibia. Its primary action is responsible for extension of the leg at the knee. The next muscle in the quadriceps is vastus intermedius. It has the exact same origin, the linea aspera of the femur, and then inserts into the tibial tuberosity of the tibia and does the same function of extension. The last muscle is vastus lateralis. It originates on the anterior surface of the femur and inserts on the tibial tuberosity of the tibia, and it also is primarily responsible for extension of the leg at the knee. And this shows all four of the quadricep muscles: the rectus femoris, vastus lateralis, vastus medialis, and vastus intermedius. Next, we'll go to the posterior side and look at the hamstring group. First is the biceps femoris. With the name biceps, it's going to have two heads, so it has a short head and a long head. The origination of the long head is the ischial tuberosity of the ischium, right up here, and then goes down and inserts on the head of the fibula. Now the short head is going to originate on the linea aspera of the femur and also insert on the head of the fibula. These muscles are responsible for extension of the thigh and also flexion of the leg at the knee. So they do the reverse action that the quadricep. The next muscle of the hamstring group is the semitendinosus. Its origin is the ischial tuberosity of the ischium and inserts on the proximal medial surface of the tibia. Its primary action is flexion of the leg at the knee and also performs extension of the thigh at the hip. And the final muscle of the hamstring group is the semimembranosus. It inserts on the ischial tuberosity of the ischium as well but attaches at the medial condyle of the tibia. They all three perform the same action of flexion of the leg at the knee and extension of the thigh at the hip. So the three muscles of the hamstring group are semitendinosus, semimembranosus, and the biceps femoris. We'll move down to the calf muscles of the leg. First, we'll look at gastrocnemius here. Its origin is going to be proximal to the lateral and medial condyles of the femur, and it inserts on the calcaneus bone via the Achilles tendon. Its primary action is plantar flexion of the foot. It also performs flexion of the leg at the knee. Now we'll look at the anterior view of the lower leg and looking at tibialis anterior. It originates on the anterolateral surface of the tibia and inserts at the metatarsal number 1. Its primary action is dorsal flexion of the foot, which is the opposite of the gastrocs. When they do plantar flexion, the tibialis anterior does the dorsiflexion.
Four, three, two, one.